Welcome to Safari Veterinary Care Centers, where your pet's health and comfort are our top priorities. At Safari Veterinary, we offer a comprehensive range of surgical services performed by our skilled and compassionate team of veterinarians and support staff. This pet has cut the flexor tendons on his right leg, resulting in hyperextension of the leg and the loss of its normal use. The bandaged leg shows an increased angle as the pet tries to bear weight, indicating that the ligaments on the underside of the leg have been cut. Surgical procedure goals. The procedure today aims to stabilize the joint so that it cannot move while the ligaments heal. We will use ultrasound to see the damaged part of the ligaments and inject stem cells into the damaged area to promote rapid healing. Preparation for surgery. The forecatheter was placed in the injured leg and is being replaced in the good leg, so the surgery can be done on the damaged leg without the forecatheter's presence. The leg is prepared by first shaving it and then scrubbing it. The scrub involves cleaning with alcohol, using back and forth motions, and alternating with a blue-colored gauze soaked in detergent scrub. External fixator device preparation. The doctor is preparing the external fixator device and pins. External fixation means that the support for the leg is external to the bone. A steel pin provides stability to the joint and is joined to other pins that penetrate the bones. Each nut has a bolt with a hole through it, allowing the pin to be driven through the hole and through the bone. The doctor is ensuring the pins are of the right size and the nuts are correctly aligned. The connecting rod pin is cut to size using a sterile pin cutter. Surgical procedure. A draping. The surgical procedure starts with the draping of the leg with sterile surgical towels. The surgical drape is placed with the aperture over the surgical site. A suture observation. The suture seen on the magnified view is from previous surgeries done in an attempt to repair the tendon. A pin testing. Threaded pins are tested in the apparatus. The sterile drill and attachments are used to screw the pin through the skin and into the bone. A pin placement. Dr. Garner placed the first pin through the skin and into the bone. The connecting rod is tightened, and other nuts guide the pins into the bone for stability. A scalpel is used to make small incisions through the skin to avoid winding the skin around the pin. C-arm evaluation. The C-arm is used to evaluate the pin placement and plan the next pin placement. Final adjustments and completion. The C-arm is used again to determine the last pin's placement. The pin cutter trims the size of the pins, and an additional pin is added for fixation. The surgical drape is removed, and the pins are visible. Ultrasound will be used to see the damaged tendons, and stem cells will be injected into the tendons using ultrasound guidance. Ultrasound and stem cell injection. The ultrasound of ligaments is performed to identify the damaged areas. The stem cells, brought into the room by the technician, are passed to the doctor for injection into the tendons using ultrasound guidance. Post-surgery care. The wound is cleaned, and additional bandage is placed underneath the pins and connecting rod to prevent tissue swelling and contact with the metal. The technician removes any sharp edges from the pins cut with a bolt cutter. The endotracheal tube is deflated. The pet is disconnected from anesthesia and transported to the recovery area. Every day, our dedicated team of veterinarians and technicians work tirelessly to provide critical care and life-saving surgeries for pets in need. Today, we share the story of a pet who underwent a complex procedure to repair severe tendon injuries and regain the use of his leg. This is just one example of the countless cases we handle with expertise, compassion, and advanced medical technology.